Hello, I'm Dr. Thomas Cholimsky, neurologist, pain specialist, and CEO of Painstakers, a company dedicated to training local health communities to manage chronic pain effectively. I would like to tell you today about our new program called 4PCP. Chronic pain places many inordinate demands and burdens on our health systems. Patients with chronic pain frequently visit emergency rooms or urgent care centers with typically little relief. Diagnostic tests and procedures may be performed and even repeated by compassionate practitioners trying desperately to find something to help them. Opioids may be prescribed with their attendant risks, including the risk of death from an overdose. Finally, we may not consider the burden on the medical practitioner, who may feel ill-equipped to manage these patients, since medical schools provide minimal training in chronic pain, about 0 to 6 hours on average. Their satisfaction with the work of managing these patients may be quite low and may even lead to burnout. Nearly all of this flies under the radar because chronic pain doesn't have a single diagnostic code, as do disorders like diabetes, obesity, or asthma for easy population recognition. Yet, chronic pain is far more frequent than any of these, 10 to 20% of any general practice. The primary solution to this high cost is changing our paradigm of care. The biopharmacologic approach, which targets the pain signal with drugs, shots, etc., works well in acute pain, but it is ineffective in chronic pain. Why? Because chronic pain is a brain disorder that requires brain retraining rather than something that targets the original pain signal. This approach is called the biobehavioral approach. 4PCP, meaning the Primary Practice Practitioner Program for Chronic Pain, trains a team of medical practitioners, physical therapists, and behavioral health professionals in this biobehavioral approach. Our pilot study showed that this approach improved practitioner pain practice satisfaction, reduced visit times, and improved patient outcomes enough that practitioners reduced or eliminated their opioid doses. Based on data from the VA, 4PCP will likely reduce opioid need by 50% or more. In summary, 4PCP provides a four-way win for patients with chronic pain. Patient care quality and outcomes improve because their fundamental problem is being addressed. For practitioners, they develop a solid skill set and a community team to manage these patients effectively, which increases their job satisfaction and avoids burnout. For the healthcare organization, they reduce costs through less high-ticket, non-reimbursed service utilization, and fewer opioids are required, reducing the risks of addiction, opioid-related mortality, and opioid-related administrative burden.